How did this blistering agent dominate the battlefield in World War I and be used as a form of cancer treatment?
Oh, no, it does both.
What?
Hi, I'm Gabby, also known as Not Gabby B, and as you can probably guess from the title, today's episode is on mustard gas, and it's arguably one of the most terrifying agents used in World War I, and was responsible for almost 400,000 casualties in World War I. Due to this, it was called King of the Battle Gases. Now, I just want to focus on the 400,000 casualties number. That's not 400,000 deaths, that's 400,000 deaths and injuries. So you don't necessarily die to be a casualty. Just want to make that clear because mustard gas was not as lethal as some of the gases we discussed before. So what exactly is mustard gas? So the name mustard gas leads many to believe that it has similar effects as chlorine or phosgene gas. However, it's a misnomer because mustard gas is actually a blistering agent that is a liquid at room temperature, and it's dispersed by either mortar or shells. It was called mustard gas because it has a yellow-brown color and it smells like mustard, or at least more impure forms of mustard gas smell like mustard. But mustard gas is also called sulfur mustard, and it has the molecular formula of C4H8Cl2S. And I will have that up on the screen. Dakota, please have that up on the screen because you gotta see it to know what I'm talking about.
I know some of these words.
So it belongs to a class of organic compounds that includes sulfur mustard and nitrogen mustard. It also contains lewisite, which is an arsenic-containing agent in this class. And again, the compounds in this class are yellow-brown and they smell like mustard or horseradish, which I don't know what a horseradish is, but I'd assume it smells like mustard. And they're all liquids at room temperature. I'm gonna keep stressing that. They are not gases at room temperature. So most historians and scientists, they attribute the first synthesis of mustard gas to Frederick Guthrie. However, there were other reports of a synthesized compound of reacting sulfur dichloride and ethylene that was done by César Mansueto Desprez. And then Albert Niemann was the first to describe mustard gas's toxic properties. He is quoted as saying, quote, "Even traces brought into contact with the skin, while painless at first, result in a reddening of the skin after several hours, and in the following days produce blisters which fester, heal slowly with great difficulty, and leave behind significant scarring." In addition, Niemann died pretty early on, and it is thought that he actually died from lung issues, which were related to sulfur mustard exposure. I don't know if you guys remember me complaining in the phosgene gas episode that the scientists were like tasting the stuff they were making, like, we have no clue what this is, but we're gonna just give it a quick taste. That's how you die. And I understand they didn't know as much back then, but ideally we just don't put weird compounds into our digestive system. I don't know, just a thought, common sense. Anyway. And finally, Frederick Guthrie synthesized mustard gas and gave another descriptive report of mustard gas and its properties after trying it on himself. Again, the good old scientific fuck around and find out, why did they keep trying everything on themselves? In 1886, Victor Meyer, a German scientist, established the Meyer method, which is the method by which the Germans mass-produced mustard gas. So the Meyer method was the first reliable synthesis of pure sulfur mustard, and it involved treating ethylene with hypochlorous acid followed by sodium sulfide. So once they did this, they actually got thiodiglycol, which was then heated with hypochloric acid, which then produced sulfur mustard. I would go more in depth, but I actually spent a decent amount of time trying to explain the structure, and I really didn't want to give an OChem lesson. And if you want more information, I will have a link to a video that kind of goes further in depth. So the scientists who did a lot of the research on the effectiveness of mustard gas for Germany were Dr. Wilhelm Lommel and Dr. Wilhelm Steinkopf, which is also where mustard gas got the name Lost. It was actually named after the two doctors that suggested it be used as a war gas. Also, side note, allegedly, while researching chemicals like mustard gas, they experimented on cats and dogs and monkeys. So that's just it's not great. But according to an article on SimonJonesHistorian.com, a trial was done which used 500 mustard shells that were fired on a range where hundreds of cats and dogs were tied. and that was to test the effectiveness of the chemical and its lethality, since it wasn't seen as particularly lethal at the time. So the other process by which sulfur mustard was made was the Levenstein process, and this is the process that the US once used. So this involved ethylene being reacted with sulfur monochloride, and this process, however, produced a complex mixture with parts that are more toxic than sulfur mustard itself and contained a 62 to 64% sulfur mustard. Since the Levenstein process, they have found a much better way to produce sulfur mustard, and that process leads to 89% sulfur mustard. Okay, so now that we discussed what exactly mustard gas is, we need to look at how it even came to be used in war. So if you've seen any of my previous videos on chemical warfare, you're well acquainted with Fritz Haber. He's the father of chemical warfare, and he's also the man that invented the Haber-Bosch process, and this helped provide enough food to potentially end famine around the world. This process is one of the most important technological advancements of the 20th century. However, even though he did this, which is ultimately a good thing, he is seen as a very controversial and evil character for what he did during World War I. See, Haber became the head of the German gas warfare program, and he fought to use gas weapons in war. When other people hesitated to cross that line, he campaigned for it because he believed that the gas would save lives by ending the war early. And, he was wrong because all it did was make every country involved race to develop and use chemical weapons on one another. But since Germany was running short on ammo, and they had more than enough chemicals to go around, he decided that it was time to turn to chemical warfare. So Haber was responsible for the first large-scale use of chemical weapons in the Battle of Ypres in Belgium on April 22, 1915. And I covered this in my video on chlorine gas because the gas used was chlorine gas. But after trying phosgene and chlorine, the Germans moved toward mustard gas. And in 1917, German forces used mustard gas during the Third Battle of Ypres, also known as Passchendaele. And Passchendaele was so brutal that the name became synonymous with blood, mud, and futility. So the Third Battle of Ypres was meant as an effort to break through Ypres. They wanted to capture the high ground and advance on ports that the Germans occupied on the coast of Belgium. However, this battle failed to accomplish these, even though it lasted over 100 days. In addition, the Allies ended up losing over 250,000 soldiers during this time and only advanced 5 miles. The thing is, the battle may have been more successful had it not started raining so heavily on the first day, turning the entire battlefield into a giant mud pit, which made it incredibly difficult for them to continue. So keep in mind, the Allies, they were actually making decent progress. They were, in some cases, winning, we can say. And then the rain absolutely wiped every ounce of progress that they were making. And, if all of that wasn't absolutely terrible, in the midst of the horrible time that was being had, the Germans decided, hey, you know what we should do? Launch mustard gas. So they would load mustard gas into artillery shells and launch them at the Allies to disrupt their advance. And as I've covered in previous videos, they didn't just use one gas. While they were launching mustard gas, they also launched chlorine and phosgene and whatever else they had on hand. And guys, this information that I'm about to discuss comes from SimonJonesHistorian.com, and it is such an in-depth and detailed description of how the Germans used mustard gas that you honestly should go check it out. There's so much more detail in there. It's an amazing, amazing resource. Anyway, the mustard gas. From the start, mustard was a defensive agent. It was used to poison areas of ground over which the Germans had no intention of attacking in the foreseeable future. This is because the chemical would linger not for a few minutes, but for hours, or at certain points, even days. And I'm going to quote this exactly so I don't mess it up, but around 50,000 shells containing 125 tons of mustard were used on this first night of defensive action. The bombardment with 77mm and 105mm shells was done in 3 phases starting at 10 p.m. for 20 minutes. It resumed at 12:30 a.m. again for 20 minutes, followed by a third phase at 1:55 a.m. for 25 minutes. On detonation, the shell sprayed not a gas as you may imagine, but instead a liquid, as I said, because it's liquid at room temperature. But in a 7-meter radius, the liquid was sprayed in the case of the 77mm, and there was a 10-meter radius in the case of the 105mm shell. Because of its extremely low boiling point, simple sunlight was enough to vaporize the liquid gradually into a lingering gas over a long period of time. So this would quite literally blanket the battlefield, which was already covered in pools of water and mud, and contact with either the liquid or this vapor would cause injury. So their clothing would, masks would protect their lungs, but this was a blistering agent. So the mustard gas would get through their clothing, or if it even got onto any exposed skin. And we'll talk about what happens later once it is on their skin. So the lack of any immediate symptoms meant that British troops didn't keep their masks on. At first, those in the bombardment suffered only slight irritation of the nose, which caused some sneezing, and on a battlefield that could be anything. However, in an hour or two, they started suffering painful inflammation of the eyes, vomiting, followed by reddening of the skin, and blistering. So remember, because this is not an immediate effect, Allied reinforcements would continue to flood into the affected areas and continue the attack, allowing more and more men to be exposed. So large numbers of British casualties began to report to medical units to the rear of Ypres. But by the time they reached the casualty clearing station, the symptoms had developed so rapidly that the men were virtually blind and had to be led in files, each man holding on to the man in front, and they were guided by an orderly or a lightly wounded man. So the thing is, the Germans didn't stop bombarding the Ypres area until the end of July. But guys, while I would love to go into more detail on the use of mustard gas in this specific battle, I think it's safe to say that it was pretty dang bad. They used it a lot, and then every country produced it, and then everyone used it a lot. So now we need to move on to look at exactly what it does to the body and how it does it. As listed above, mustard gas produces skin blisters, and it damages the eyes and respiratory tract. And even though at first the Germans didn't think it was lethal enough, in high doses it is lethal. It poisons cells, it's a mutagen and a carcinogen. Basically, a mutagen causes mutations in cells, and carcinogens, they cause cancer. So it's pretty terrible on all fronts. According to the CDC, exposure to mustard gas can lead to decreased formation of blood cells and platelets, which can lead to bleeding and infections. It can cause diarrhea, nausea, and vomiting. It can lead to temporary or permanent blindness, as well as eye pain, swelling, and irritation. It may cause lung damage or respiratory failure, in addition to convulsions. So long-term health effects of mustard gas are respiratory cancers, chronic breathing disease, skin cancer, and scarring and pigment changes. The skin is the largest organ in the body. It has 3 layers. We have the epidermis, the dermis, and the subcutaneous fat. And burn severity is actually determined by looking at how many of these layers are damaged. Our skin is so important in protecting our internal organs and keeping out infectious agents, as well as preventing things in our body from leaving, like fluids. What happens when your skin breaks? You bleed. Skin is important, And mustard gas is really, really good at damaging the skin. So mustard gas is an oily substance, which means that it is soluble in fats and oils, which is ideal for the purpose of breaching the skin because our skin is a really good transport system for the lipophilic nature of mustard gas. So lipophilic literally just means soluble in oils and fats. Mustard gas passes from the skin into the bloodstream after exposure, and that means that it can travel and cause more damage throughout the body, in addition to the damage that it also does to the skin. So the good thing is, according to NCBI, only about 20% of a dose of sulfur mustard penetrates the skin, and that's even under the most ideal conditions. So NCBI says, quote, Renshaw, which is their source, 1946, noted that sulfur mustard liquid or saturated vapor penetrates human skin at a rate of 1 to 4 milligrams per centimeter squared per minute at 21 degrees Celsius. So any increase in ambient temperature causes increased penetration. But as always, the effectiveness of mustard gas largely depends on the amount you're exposed to, whether you were exposed to a liquid or vapor, how long the exposure lasted, temperature, and how intact the exposed skin is. The best descriptions that have been given for the effect of mustard gas on skin come from studies done on people exposed during the Iran-Iraq conflict, which is another conflict where mustard gas was used. And that one was much later than World War I. So after exposure, the patients experienced intense itching, followed by inflammation and blister formations, breaking of skin, ulcer formation, and necrosis of skin cells. The skin changes color by darkening, typically. And the super not great thing about all of that is the same thing also happened inside the lungs, depending on how much you breathed in. So in an article by the National Museum of Health and Medicine, an Australian pathologist named Robin Cook, who has done a lot of work related to the pathology of poison gas, he stated that, quote, if you make microscopic sections on these 100-year-old specimens, a veritable wonderland of changes comes to light. So Dr. Cook said that German pathologist Walter Koch, which I'm pretty sure I've mentioned in previous videos, said that the respiratory tracts of soldiers exposed to gas during World War I look similar to those who suffered from diphtheria. Diphtheria is a very serious infection that can cause life-threatening and long-lasting complications, and at this time it was relatively common. So the thing is, exposure to mustard gas would damage the lining of the respiratory passages, which opened up the affected soldiers to even more serious infections in their tissues. And these could be life-threatening, like pneumonia, like they could actually get really freaking sick. And this was shown when workers at a mustard gas factory died after an explosion in 1930. So yeah, just like an overall terrible time. So the thing about mustard gas is that death occurred in only about 1% of the people who were exposed to the gas, well, to mustard gas, not a gas, you know what I mean, and got medical treatment. So it was terrifying, but they would probably live. The thing is, mustard gas was more incapacitating than anything. In addition, in one of my previous episodes, I talked about how just the thought of possibly being exposed to this chemical caused symptoms in soldiers that had never even experienced an attack. So there was like a real psychological aspect as well. So yeah, after World War I in 1925, the Geneva Protocol put an end to the use of chemical weapons in warfare. However, it did not prohibit developing, producing, or stockpiling chemical weapons, and that's why we saw a lot of developments in these weapons going into even the Cold War era. However, in 1969, the US did renounce the development and use of all biological weapons and chemical weapons in war. And since then, they've decided to turn their focus to actually storing and disposing of these chemicals that they had stockpiled. So, according to the American Chemical Society, mustard gas stockpiles can be incinerated. However, the best method of disposal is hydrolysis. And basically, hydrolysis just means that they use water to break it apart. So the water reacts with the mustard gas and it adds hydroxyl groups, and this basically goes back to thioudiglycol and hydrochloric acid. And this process is honestly way more thought out than what they did post World War II when the mustard gas that was found in Germany was just dumped into the Baltic Sea. So now, this is possibly the most interesting part of this whole episode. How did mustard gas relate to cancer treatment? Like, how did that translate? Well, progress on the use of mustard gas in cancer treatment wasn't made until World War II. In World War I, researchers noticed that mustard gas destroyed lymphatic tissue and bone marrow. However, it wasn't until two doctors at Yale University, Louis Goodman and Alfred Gilman, studied the medical records of soldiers that were injured by mustard gas, and that is when the progress started to get made. Now, keep in mind, in World War II, like in this time, they were actually looking back at mustard gas just to see if they can come up with ways to prevent their soldiers getting more injured, because they were afraid that mustard gas was going to be used in this war too. But while they were looking at it, they were like, hey, this is actually some really important information. We could use this in healthcare. So basically what these two doctors noticed is that they had very few immune cells in their blood, like the victims of mustard gas. And these cells are the ones that typically mutate to cause cancers. So upon seeing this, they started to wonder whether mustard gas would also be capable of destroying cancerous cells. These two doctors started running tests on animals such as mice and then on rabbits to see if there was any truth to their theory. And after successful animal trials, they decided to move on to testing on patients. The first patient to participate in this trial is known by the initials JD, according to cancerresearchuk.org. JD had a very advanced lymphoma. He was 48 years old and he was in the terminal stages. He was out of treatment options at the point where they found him. And then they were like, you want to try this? And he said yes. JD had a tumor on his jaw that actually kept him from sleeping or swallowing. He also had tumors under his armpits, which meant he could not comfortably move his arms or lie down. So on 10 a.m. on August 27, 1942, he was given nitrogen mustard. This was done 10 times and he was given about 2.5 times what became the standard. His treatment was actually kept secret until 1946 due to the fact that it was wartime. But he started getting better little by little. And even though he did end up relapsing, he did see an improvement to quality of life even though it was temporary. Now, yes, they did see, improvement, and yes, he did have better quality of life towards the end of his life. But the sad part of this story is that 6 months after he started treatment, he actually ended up passing away. And this entire thing, though, was the beginning of what we now call chemotherapy. After World War II, Professor Alexander Haddo started looking into things that could block tumor growth, and the molecule that he turned to was mustard gas. In 1948, he published research showing how nitrogen mustard killed cancer cells, and exactly which parts of this molecule were effective at this. He was able to show the effectiveness of nitrogen mustard at stopping tumor growth in rats, and then he continued editing the molecules to show which part of the nitrogen mustard molecule was necessary for blocking tumor growth. He found ways to make the treatment more effective and ways to make the chemical less toxic. And nitrogen mustard-derived chemotherapy is still used today to treat certain forms of cancer. According to cancerresearch.uk.org, the chemical structure that Haddo published was only a few atoms away from the structure of chlorambucil, which is still used to treat chronic lymphocytic leukemia, as well as non-Hodgkin lymphoma. In addition, because of the work that Haddo did, other types of chemotherapy treatments were developed that were more effective in dealing with certain types of cancer. But yeah, that is the short story, medium story. That is the story of mustard gas. The good, the bad, the ugly. Thank you guys so much for listening, and please make sure to subscribe, and if there's any topic you want covered, let me know in the comments. Bye guys.